The following is a special video presentation of the Hennepin County Library.
Hello, I'm David Lindeman of the Hennepin County Library, and today we're speaking to Lorraine Teel, the Executive Director of the Minnesota AIDS Project. Welcome, Lorraine.
Thanks for having me.
Could you tell us a little bit about what the Minnesota AIDS Project is?
Well, the Minnesota AIDS Project is a community-based organization which provides both HIV education, information about how to prevent transmission of HIV, the virus that often leads to AIDS, as well as services for people that are living with either HIV or AIDS. And we are a statewide organization. We have an office here in Minneapolis, and we also have offices in St. Cloud, Duluth, Rochester, and Marshall.
Now, the Minnesota AIDS Project, or MAP as most people call it, is a community-based organization. I think that's very interesting to me anyway. Could you tell us a little bit about the origins of MAP in the 80s and how MAP and some other organizations in other large cities got started in the early years of the AIDS crisis?
Sure. Well, back in the early 80s, when people first started talking about what was this disease that was occurring mostly with gay or bisexual men, people didn't really know how to respond. The government had a woefully low response to this situation, and throughout the country, including here in Minneapolis, the community came together and volunteered as a grassroots effort to begin providing services to men who were becoming ill and needed support. There was a lot of discrimination that was occurring. Physicians, hospitals, nursing homes were fearful of providing services for these people. And so the community came together in a wonderful effort to provide volunteer support. And from that origin came the Minnesota AIDS Project. When the virus was first discovered in the early 80s and people understood how transmission did occur, MAP became a statewide voice of reasonableness in how the virus was and was not transmitted, because there was so much fear and concern about could you become HIV positive from casual contact, or what exactly caused the virus to be transmitted. And so we began doing a lot of education, both with communities who had high-risk behaviors as well as with the general public.
AIDS is a disease, or a combination of diseases. It's a syndrome, but I think it's the most politicized medical condition that I can possibly think of in probably history. You think of heart disease or cancer or almost anything else, and there isn't the fervor or the activism surrounding it that there is in AIDS on a national level. Could you describe why that is, or how it came about?
I think what happens is with HIV and with AIDS, you have the two main methods of transmission now that the blood supply is being tested, and that transmission very rarely occurs that way. That the two main modes of transmission include unprotected sex, sexual activity, and the use of injecting drugs or intravenous drugs. Those are two situations, two subjects that we as a society have taboos about, that we don't like to talk about. That in order to talk about HIV, we can't just say unprotected sex. We need to be specific, and we need to be technically accurate. When we talk about the use of drugs, we can't just say don't use drugs. We need to talk about what is there about the use of drugs and how, by injecting drugs, the virus is transmitted. Those subjects are very highly political subjects that adults often have difficulty talking to their children about, that school districts have difficulty talking about in frank and open ways, that church groups or community civic groups often have difficulty knowing how to frame. And so for those reasons, I think that HIV becomes such a politicized issue. Second, I think because, as you mentioned, heart disease, cancer, kidney disease, others have for a long time reached a level and have maintained that level. You have HIV and AIDS that came out of nowhere in the before 1981 and have suddenly skyrocketed to the point where AIDS is the second leading cause of death for young men in this country between the ages of 25 and 44. So you have a tremendous amount of research dollars now being spent. You should, because you have a disease that in less than 10 years has, as I said, become the second leading cause of death for young men, whereas the other diseases have maintained their stability and have had for decades research dollars being pumped into them. And we don't want to see this epidemic continue to explode to the point that we have to wait for it to become the #1 leading cause of death. And so there is a need for appropriate response.
Just how does Minnesota stack up in terms of the resources available for people with HIV and AIDS, the services, the medical establishment? How does it stack up to other states in the nation in terms of its response and its ability to deal and care for people with HIV and AIDS?
Well, Minnesota is what's referred to as a lower incidence state. Our number of AIDS cases and number of cases of people who have tested positive who have not gone on yet to develop AIDS is significantly lower than some of the states on the coast like California or New York, cities like Washington, D.C. or whatever. So we have had some time to learn the lessons that have occurred in those cities and to develop service networks and medical responses as those cities have done, so that we have a much better ability to respond and to provide services for people. We have a good case management system in place through the Minnesota AIDS Project, through other private hospitals and community clinics statewide. We're able to provide clinical trials, that is testing experimental drugs, over at the University of Minnesota for people as well as other test sites. So we've had a chance to develop a good response. However, what's happening is that we have a lot of people who are Minnesotans who have tested positive, who may be living in New York, California, Washington, who are now coming back home to be with their family, to be with their support system. As those numbers continue to put pressure on the system will need to grow, because we can't continue to provide that same level of services long term as the numbers increase.
I'm curious how living in outstate affects people who are dealing with this, both in like a family who might need support, or an individual who is dealing with an actual chronic medical condition. I can see where living in the Twin Cities metropolitan area would be a real asset, particularly like the university AIDS clinical trials and access to the best and the finest. But what happens to people that live outstate in the rural areas?
Well, that's really a tremendous question, and really a very important point. For people in greater Minnesota, there really is still a stigma, as there is in the Twin Cities, don't get me wrong, but in the Twin Cities there is a community of people that are living with HIV that you can communicate with and talk to on a regular basis. When you're living isolated in greater Minnesota, you're facing a number of problems. You're facing simple problems of accessing care, of finding physicians that are within a range that you can easily get to, who understand the disease and know what treatments are out there and so forth. Not only physicians, but dentists and other healthcare providers as well. So you face that problem. You face a problem of, do you want to come out to your neighbors and friends and others that you may meet casually or that you may meet at church, whatever, because of the stigma of HIV that really does exist out there. So you have that whole issue. And I think an even greater point that we're finding through our outstate offices are a number of families who are getting that phone call from their son, their daughter, their aunt, their uncle, who is living somewhere else, who tells them that they themselves now, or a child of theirs, is HIV positive or has a diagnosis of AIDS. And that family really feels isolated. They don't know where to go. They're not sure who they can trust and who they can talk to. Because even today in 1993, we still, many erroneously feel that if you're around someone casually that is HIV positive or the family member of someone with AIDS that there's a risk of transmission. And so it's a very difficult situation.
What do you think the average person on the street, well, either in urban Minnesota or in the more rural areas, actually knows about AIDS? Do you think they've tuned it out? You mentioned earlier that there's a perception, well, it's not a perception, it's a reality that Minnesota has kind of trailed the nation in terms of the numbers of actual AIDS cases. Do you think people are a little bit complacent here, thinking that it still can't happen here like it's happened other places, and therefore have resisted learning anything more about it?
I think some of that, and I also think that just as with cancer, whatever, any other disease, that we know as adults, we read the paper and watch TV and we learn a little bit about a lot. And then when it comes home to roost, and that's to say a friend of yours or you yourself or someone that you work with confides in you about their HIV status, suddenly you realize how much you don't know and how many questions you do have. Questions about that person's prognosis, questions about transmission, questions about how does the virus work. So you suddenly, when the situation comes home, you realize how much more information you do want to have. So that's one issue. In terms of how far we have to go with education, we need to continue it. It's not so much how much further do we need to go as how much do we need to maintain and continue. HIV education is not a one-time event. That's to say we can't turn to our children at age 6 or 12 or 15 or whatever one time and tell them about HIV, the virus, and how they should protect themselves or whatever, or how transmission occurs or doesn't occur, and assume the child will know that and retain that. We know from studies about smoking, seatbelt use, cholesterol in the diet, we need to repeat the message over and over and over again in a variety of different ways, in a variety of different settings, be that on television shows, be that on bus ads, be that on billboards, be that in print media, on the radio. The message needs to be continue to be driven home, and that's what we need to do with HIV.
What about the youth, kids that are, 15 to 20 years old? I would think that'd be a very difficult population to educate. They somehow feel that they're immortal.
Right.
A lot has been said about the increase in positive HIV tests among youth. Could you respond to that? What is it like in Minnesota? Are people listening? Is there resistance on a local level to AIDS education? How's
well,
it
the
going?
15, when you talk young adults, say 15 to 25, when you've got that group 15 to 18 that's in high school, yes, there are a lot of restrictions and a lot of concerns, appropriately so, that parents have about the education of their children. However, we need to educate those children, and whether that occurs at home or whether that occurs in school, it has to be technically correct information, it needs to be up-to-date information, and it needs to give the child choices. In other words, whereas abstinence, sexual abstinence is always the lead message with any HIV education program, you need to understand that as an educator, as a parent, that children are sexually active and they need to know what their choices are and how to protect themselves.
But is that happening?
It happens sporadically and it happens in different ways and with different intensities. And perhaps the best education is at home with the parents, and we need to work to educate not only the children but work to educate the parents so that they in turn educate their children. Otherwise, our children learn from each other, and that information is often not accurate and not up to date. And so we need to be able to access schools, access children as HIV educators, and be allowed to talk to them in sometimes fairly frank terms about the virus and how to protect themselves. One of the areas that I think we are truly missing is the area of television and radio advertising. As we know, children between those ages, or young adolescents, young adults 15 to 25, are media hounds. And we really need to be able to access the airwaves, both radio and television, with responsible condom advertising, responsible HIV advertising that just doesn't frighten people, but lets them know, again, what their choices are and how they can take responsibility for their behavior.
Correct me if I'm wrong, but I believe that AIDS education was mandated in through the Department of Education in Minnesota, and was funded fairly adequately until about a year ago.
That's correct. There was a mandate that all school districts throughout the state develop a curriculum that is technically accurate, up to date, involves the parents and community members in establishing the curriculum, targets youth that are labeled high risk, and provides that education. And that mandate came with dollars attached to it. That funding ran out and was not renewed in 1991. And what's happening now is that we have school districts throughout the state that do have AIDS curriculum, but there are no dollars attached to that in terms of, number one, ensuring that it's delivered accurately, and number two, updating that curriculum. So we have two dedicated state Minnesota Department of Ed employees in St. Paul here who are responsible for seeing that this happens statewide. And the funding for their positions and costs comes from a grant through the Centers for Disease Control in Atlanta. So currently there are no state dollars going into AIDS education, unfortunately.
And the two people is a skeletal staff that was cut from a much larger staff a few years ago.
Right.
How has AIDS changed, well, particularly in Minnesota, from the 80s to now the 90s? Are there different risk groups? Are the demographics different? What's changed?
Sure. What puts you at risk for HIV is not the group that you're a part of or who you associate with. It is the specific behaviors that you engage in. And what we're seeing is that people with AIDS who were probably infected with the virus perhaps up to 10 years ago or longer are individuals here in Minnesota, primarily gay and bisexual men, and to a lesser extent those who inject drugs, and the heterosexual partners of those who inject drugs who were sharing needles. What we're seeing now with people who are HIV positive, who may have been exposed to the virus a year or 2 or 3 years ago, we're seeing increasing numbers of injecting drug users and their sexual partners. Now, not to the same extent that we have nationwide. There are still many gay and bisexual men here in Minnesota who become exposed to the virus. And so again, just like with youth, just like with any individual, we need to continue to drive the message home and to be consistent with the message and to be persistent with the message. And but we are seeing some changes. Again, we're seeing increasing numbers of African Americans who are exposed to the virus, and some of that comes through unprotected heterosexual sex, some through the use of injecting drugs.
What changes do you see right now in terms of like federal assistance? The 80s and the early 90s, the Reagan-Bush years, were particularly rough, I believe, for AIDS. There just wasn't a cooperative effort on a national level. Now with the Clinton administration, now in 1993, do you see things looking up, changing a lot, or what do you see coming?
We're much more hopeful in terms of HIV funding. There was some landmark legislation that was passed, the Ryan White CARE Act, which was a federal funding mechanism to provide service dollars for people nationwide with AIDS. And the importance of that, some viewers may wonder, well, why AIDS, why not cancer or kidney disease, is because nationwide people with AIDS are still unable to access health care because of the residual discrimination and fear and phobias that exist about HIV and AIDS nationwide. So the federal government stepped in with the Ryan White CARE Act, named after the young Indiana boy who died from AIDS a few years ago. That act was never fully funded. It was only given a
Yes.
very small amount of funds. Now in 1993, President Clinton has committed to full funding of the Ryan White Care Act. However, that's still back at the 1990 levels,
Right.
and here we are, we'll be moving into 1994, and the epidemic has grown. So we need to, again, try and convince folks in Washington of how vital those care dollars are.
Can you tell us what the prognosis is today in 1993, the spring of 1993? 5 or 8 years ago, a lot of people thought that an HIV positive test from the doctor was a death sentence. What does it mean today?
Well, now when you test HIV positive, there are a number of early treatments that you can access, and primarily 2 areas. One is antiviral medication, and that is medications that help slow the rate at which the virus replicates in your system. And there are different drugs available for that. The one that most people are familiar with is AZT, but there are other drugs that are available. We find that early treatment with AZT and these other drugs will help extend a person's life considerably and stave off the diagnosis of AIDS. And then there are a whole series of drugs that help fight the types of infections that cause an AIDS diagnosis.
So we're talking about good case management.
Yes.
And instead of, well, just basically good case management,
Right.
catching the disease
Right.
much earlier.
Right.
Now, we mentioned at the beginning of the program that the Minnesota AIDS Project is largely community-based, and coming this spring, as in every spring,
Right.
you're doing what is called a pledge walk. Could you describe that very briefly now in
Sure.
the last couple seconds of our show?
Sure. The Minnesota AIDS Pledge Walk will be this year, May 23rd, 1993, at Minnehaha Park. And it allows an opportunity for the community to come out in force, make a strong statement about the fact that they care about AIDS, they care about people living with HIV, and come together, bring their pledges together, and support not only the Minnesota AIDS Project, but 15 other organizations statewide that provide services for people living with AIDS.
Well, thank you, Lorraine.
Sure, thanks.
This has been Lorraine Teel with the Minnesota AIDS Project. I'm David Lindeman with Hennepin County Library, and here are some scenes from last year, the 1992 AIDS Pledge Walk.
People are here celebrating today because the people that are here that are living with AIDS are doing just that. They're living with AIDS. They're not dying from AIDS. And AIDS is something that we can medically manage so much better than we could in the earlier days of the epidemic. And we want to celebrate life and also take a moment to remember those who have died and who have suffered the ultimate horror of this virus. And so it's important that we take that time to celebrate their lives and remember them as well.
Ignorance equals fear, silence equals death. Fight AIDS, act up.
And hopefully they'll find a cure someday soon. And maybe the money that we raise today will help find a cure.
Last year I lost 4 friends to AIDS, so it's more and more important all the time for me to do whatever I can. And with the matching grants, that helps a lot. And I wouldn't miss it.
event that happens one day a year, but most important, it's an event that we plan for and work hard towards year-round. It's an event that supports not only the work of the Minnesota AIDS Project, but 15 other AIDS service organizations across the state. So what's so important is to get people actively involved year-round in volunteering and talking about AIDS and educating their friends, their neighbors, their children about the subject.
Senator Paul Wellstone.
Leslie, thank you. Thanks, everybody. Well, I guess I just wanted to say to Lee and everybody, this is the alternative to cynicism. This is what it's about when people in their community make a commitment to a struggle they believe. Large numbers of people come together. We walk, we support each other in the struggle against HIV and AIDS. And I think that all of us together have been one grand team. But let's hear a hand for some of the special Pledge Walk teams that have been involved in this today.
Yeah.
Understand the power lies well within our hands. It's time for us to speak the truth, every woman, every man. Hearts ring out around the world. Hear us if you can. You can take a stand, you can make a difference too. You can lend a hand, now it's only up to you. If we come together, you know we can try. We can make it better, don't let life go by. You can trust your heart, you can make a difference too. Now it's time to start and it's only up to you. If we come together, you know we can.
A presentation of the Hennepin County Library.